Good morning, everyone. Thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County, and today I am joined by one of our team members, Amanda Dogger, who is the Overdose and Substance Misuse Prevention Health Specialist. It's a very long title, but basically what it says is Amanda is very active in the community and helps us a lot with substance use and prevention programs. So today we're going to talk a little bit about overdoses and items related to that, and you're probably wondering why is that? Well, because it's Overdose Awareness Month, and whenever we say overdose, that conjures up different images in different people. It depends what your experience is, depends what your background is, and that is okay. But one of the things we want to do is get to know a little bit of the facts. So first of all, thank you for joining us today. And what should community members know about overdoses in our region? What should we tell them?
Well, thank you for having me. So, one thing I think community members should know is that overdose can happen to anyone, anywhere, at any place. And then also that majority of our overdoses are actually happening in home. And then, of course, the young ones. We have been seeing some overdoses in our young youth, and that kind of maybe pertain to the fact that their medications are not getting safely stored at home.
Okay.
And then also we have that a person can even overdose if they're even following their doctor's orders that have been prescribed that medication. That can be due to the fact that maybe they forgot to take their medication, or it may be too strong for them, and they can overdose for that.
Wonderful. I'm glad you clarified that, because when we say overdose, I think people's minds go to illicit substance use immediately. And of course, that is one of the components, but we also have accidental overdoses, as you mentioned, specifically in the elderly, it happens.
Yeah.
Because I forgot to take my meds, so I take 2 or 3 instead of 1. And as you pointed out, we have seen an increase in the overdoses going to the emergency room on youth and young adults, which is always of concerns. So I think you already alluded to perhaps a misconception that people have,
Yes.
which is, okay, overdoses are only happening over there
Right.
to someone else, and that's not the case. As you mentioned, it could be anywhere, anyone, anybody, any strata of the community, many of them at home. Any other misconceptions that people, that you hear in the community as you go around?
So going off of that, there are, some people think that overdoses are just happening for those that are without a home,
Okay.
or that are on the street, which I mentioned that they're more in a home. Then there's those that they talk about, if somebody, once you administer the Narcan, if somebody's overdosing, and you administer the Narcan, they wake up violently and they're going to be swinging at you. Majority of the time that doesn't happen. It's somebody getting Narcan, they might wake up a little confused, maybe don't know where they're at. I always tell people, step back, give that person some room,
Some room, yeah.
before you try to say, hey, I'm here. And then that way they kind of feel comfortable. Another thing is I always get people talking about the liability. Well, what happens if I do
Right.
administer Narcan? Well, there are Good Samaritan laws that protect you.
Yep.
One of them protects you if you're giving that first aid you're from no liability. And then the other one is protecting that person from any type of drug possession charge. So
Right.
those are 2 Good Samaritan laws that protect you for administering naloxone.
Wonderful, and I know that we have an example over
Yes.
here, but a couple of things you said I think are very important for people to remember. So first of all, if you see someone and you think that person has overdosed, first thing, call 911.
Yes.
Make sure that you have emergency services coming. If you happen to have Naloxone, Narcan, some people call Narcan, so, there's commercial names and so on and so
Yes.
forth. Do not be afraid to use it because you're not liable, but more importantly, if the person that you administer that to is not in overdose, an opioid overdose, it's not going to harm them
Right.
medically, which is something I hear too. Well, what if I give them this and this harms them? It won't. It only acts with the appropriate receptors if there's something there to do. So I know that we've been talking about overdoses for a few years now. Unfortunately, we continue to see that. But I also know that there has been a lot of work in the community that you and I have been part of.
Yes.
So can we share with the community a little bit of some of the efforts that you see, some of the successes, what's going on out there?
So there are many groups and organizations in Spokane County working on this opiate crisis. We have coalitions that do prevention work. They do events. They also educate. There's organizations that do Narcan training, Naloxone training. I myself was one of those, have been trained to do Naloxone training. I have done many organizations. I've helped individuals. And today I actually have, this is just a little trainer. So when I go in and do my trainings with organizations and our individuals here in Spokane, I share about how easy it is to use the nasal spray. And this is just a little, you just push it up, you put it in the person's nose, and you spray it in there. You don't have to plug the side of the nose either. You just can spray it in there. Like I said, give 2 to 3 minutes before you administer another dose of naloxone. There's also the injectables. I know some people are kind of leery on these injectables. They are safe, they are easy to use. You do have a syringe and you have a little vial. I always tell people, make sure, just pull the syringe out to get a little bit of air in there, then put the medication in there. You just can put this in there intramuscular. You can put it through your clothes, it doesn't matter. And then, of course, it's an easy way to do it as well. And like I said, first thing I always tell people, call 911 first, get those EMTs on board, and then start the naloxone. And if you're interested in any of those, let me know. Reach out, and I can share more information.
Thank you, wonderful. And I know that there are not only efforts by both the city and the county that are very successful, and we say thank you to them for that. Fire department, the stabilization center,
Yes.
all of these deployed resources that are there to help. But we also have a lot of community groups that have come together, like Gabriel's Challenge and Stay Safe and Healthy Spokane, the Fentanyl Roundtable, SAFE, which is Spokane Alliance for Fentanyl Education, Youth and Young Adults. Our K through 12 is doing a lot in prevention. So I think there's a lot happening that the community sometimes we say, well, no one is doing anything. I go like, actually, that is not true.
Right.
There is a lot of work, and we're getting much better at coordinating the work, as you mentioned. So I'm glad you showed the intranasal, because some people have an allergy to anything that looks like a needle. Some of us don't like injections.
Yeah.
I happen to be one of those. But they're very easy to use. That's very easy to use, and it's very easy to carry. Now, if I'm someone that is struggling a little bit with addiction, or I know someone, relative, friend, colleague, what are the resources, and where do I go to find those?
There are many people and many organizations that offer treatment, recovery, those that support maybe you've lost someone into an overdose. There are a great website, you mentioned SAFE, that is the Race Redeem Foundation. And about 4 or 5 years ago, they created a website called Addiction Finder. And that is a simple website where you can go up. They have listed even your insurances or what insurance you have. They also figure out which one you're needing. So you have a few questions to answer. Are you needing support? Are you needing recovery? Are you needing treatment? And you go in there and you can find those resources, and they have the list of them, and you can contact them that way.
Wonderful. And I know that if you go to the SRHD, the County Health Insight, there's also a resource there. So there are a lot of resources in the community, and if you're not sure, you can always contact us, and we'll be happy to point you in the right direction. I don't want to miss something that you mentioned, which is training and education. Sometimes people don't feel they can do this because they don't know how to. And they're concerned that they may not do it appropriately. So there is a lot of training. I know that you do training. I know that our Medical Reserve Corps volunteers get deployed to many community organizations and companies, etc., to get training. So if you're not sure, let us know. We can point you in the right direction where training will be happening. So in addition to what we've talked about today, I'm the average member in the community. I'm not necessarily as involved. So what can I do to support those that are at risk, and what can I do to support those that I may not even know, but I could be helpful with. So.
Yeah. So there are, like I mentioned before, there are coalitions, community coalitions. They do a lot of work. There's task forces that are happening in our community too that do offer those support. And one of those task forces is the Spokane Regional Opiate Task Force. A lot of them, we put on events. The coalition put on events too, so that's a way to come and support. And talking about event, we are having, the Spokane Regional Opiate Task Force is having a Healing Hands Creative Hearts event this coming Saturday, which is August 16th from 11 to 2. It is around the same time as Unity Community. We have partnered with them to do that. It is at the Central Library, which is 906 West Main. What that is going to entail is we have community partners coming to share their resources. We also have invited guest speakers to come and share about overdoses, how to prevent overdoses, having that support if you've lost someone to an overdose. We also have guest speakers that are going to share about their lived experiences of being in recovery. And then we have a live band, we have some performers, where it's going to be a free event, there's going to be snacks. This was created to give that support and that hope to those that are in this community. One thing that we would like to really stress about is the fact that those that are in our community that may be struggling with substance misuse, that there is hope, there is a way to get that help, and then also those that have lost their lives to somebody of overdose, that you're not alone. There are people there that can help you and work through that with you. So if you are in the area, please come. It's a free event. Like I said, it's from 11 to 2. It's going to be a lot of fun. We're going to have crafts. We're going to be making little buttons. We'll have free services as well. So.
Wonderful. So make sure everybody has that on your calendar. It's this Saturday, and it was up there, but now it's gone. But I think it's this Saturday at the Central Library from 11 to 2. Central Library over there. Everybody knows where it is. A great, beautiful building, actually. So a couple of things to recap. We started and we talked about Narcan, Naloxone, and the importance of training, knowledge, and not being afraid of using it. Always call 911 first. And if you're not sure where to get it, I know that there is access. For example, we partner with the libraries. Mm-hmm. So there's some of the libraries. We just completed some training for the YMCA, so that eventually we're going to have some dispensers there. And the reason for that is to make sure that people don't feel, well, I shouldn't have this because I don't use anything, so why should I have that? Right. Well, it's like having a first aid kit. Lots of people having their first aid kit. The same way you will stop and help a stranger that has a wound, yeah, or is suffering what you think is a heart attack. We'll stop and say, can I help you? And then call 911. Same thing. But you have to have the tools to do so. And I see this little Ziploc with a lock. Can you tell us about that for people that are watching the show?
So we offer, my program offers safe storage boxes, and this is a safe storage pouch. It has a lock on it. We offer those for free to any community member. And we also educate about safely storing your substances. And when I talk about substances, I'm not only talking about medications, I'm talking about cannabis, gummies, cannabis products, nicotine products, and then as well as your medications. To safely store those for limiting your youth access, your young ones access, and even your pets as well.
Well, thank you. I'm glad you brought that because at the beginning we mentioned accidental, sometimes kids, children and youth, young adults, and to be curious. Yeah. So we have to make sure that they don't have access to something that could be harmful to them, and that is a good way. And because it's free, there's no excuse not to have one, right?
Yeah.
So I'm going to say thank you to Amanda. I'm going to take a moment to also say thank you to a very, very, very long list of our community partners that are engaged in this effort. We have had the opportunity and the privilege of working with many, over at least in the years that I've been here. And folks, a lot of progress has been made. More work needs to be done, and anyone can be part of that work as we go forward. You don't have to be an expert. And I am confident that if we continue working together, we will actually tackle this issue in a way that is beneficial to all parties in the community, and that we as a community will be able to say, you know what, we took care of this in Spokane. So let's work on that. So I'm going to say thank you again. It's hot out there. Wildfire risk, so please be mindful. Take care of yourselves, take care of others, and don't forget the event on Saturday. We'll see you again next week. Thank you very much, and have a great day. And Amanda, thank you for joining us.
Thank you.